Good morning, everyone. I would like to begin my speech by posing a question. Please raise your hand if currently you would be willing to pay for a drug that was proven to be an inert substance. Okay, not many of you, but what if I told you that even though the drug itself was inert, it could still produce therapeutic effects? This leads to the topic of my speech, the placebo effect. A placebo can be defined as a compound that has no pharmaceutical value. The placebo effect can be described as a therapeutic response seen within a patient due to a placebo. Due to the inert nature of a placebo, this phenomenon is generally misunderstood. In this speech, I will attempt to discuss the causes of the placebo effect. Through research, 3 notable causes of the placebo effect include psychological factors, physiological factors, and the interaction between a doctor and their patients. To begin my discussion of the placebo effect, I would like to describe the psychological factors that impact its efficacy. According to Elliott, an accredited ophthalmologist, he states that the psychological concepts of expectancy and conditioning impact the effectiveness of a placebo. Elliott describes expectancy as a patient's expectations. If a patient expects to get better, then he or she generally will. Elliott describes conditioning as repeated results from repeated actions. For instance, if a patient continually takes ibuprofen and continually gets pain relief, then subsequent administration of the drug will lead to pain relief, whether or not the ibuprofen itself is active or inactive. As you can see, these 2 concepts cause patients to anticipate the outcome of a treatment based on previous behaviors and mindset. In this case, the mind will generate an appropriate response to a specific stimuli. When a placebo is taken, the mind thinks that a legitimate drug is taken. Therefore, it will create bodily responses as if a drug has been administered to the patient. Now that the psychological factors have been described, I would like to discuss the physiological factors that impact the placebo effect. Physiological factors include the activation of biomechanisms. The biomechanisms that relate to the placebo effect include activation and inhibition of neural pathways. According to Pasternak, who directs the Biomedical Center at Oxford, he determined that a placebo can activate the opioid pathway, which reduces pain, stimulate the release of dopamine, which helps with Parkinson's disease, and stimulate the release of serotonin, which helps lower depression. These neural pathways are pre-existing within our body. In the instance of physiological factors, the body itself will produce molecules such as neurotransmitters and hormones that mimic or are exactly the molecules that the drug itself would release. Therefore, since the same molecules are present within the body, the patient will experience the same responses. Now that the mental and physical factors have been illustrated, I would like to move on to the social factors that impact the placebo effect. The social factors are the most important factors towards the placebo effect. Arnold et al., who write for the Internal Medicine Journal, state that, quote, pure social interaction can, in some circumstances, be as powerful as the action of a pharmacological agent. In other words, just the interaction between a doctor and their patient can be enough to produce therapeutic effects. This is due to the nature of the relationship between a doctor and their patient. According to Arnold et al., due to numerous reasons, the doctor holds more power within the relationship. Therefore, the doctor becomes somewhat of an authoritative figure. Through their power in the relationship, a doctor is able to highly impact the patient's expectations. This ties into the psychological factor of expectancy. Because the doctor can influence a patient's expectations, he can therefore elicit specific bodily responses. In conclusion, the placebo effect is a legitimate phenomenon. This phenomenon occurs due to psychological factors, physiological factors, and social factors. Thank you for listening to my speech, and I hope that you have become more familiarized with the mechanisms behind the placebo effect.